Hello everybody, my name is Jean Bastilla. Again, you know Jean Bastilla. I have been there on a regular basis. The guy who is there to look out for the community, the guys who've been bringing a lot of education for everybody in the community, but the lover of the seniors, Jean Bastilla with AWC Home Care. I want to say thank you to all of you who is taking your precious time to watch this video. Today we are going to talk about a very significant topic. A topic that is extremely important in society. We're going to talk about urinary tract infection. As many of you know, urinary tract infection is one of the very common issues that we have in our society. It affects everybody from children to adults to seniors. Again, as you all know, we're very passionate about the seniors. So definitely we're gonna focus a little bit on seniors as far as urinary tract infection. Again, if you just tune in, I want you to sit back, relax. We're gonna take you through urinary tract infection. We're gonna talk about it. We're gonna talk about what it is. We're gonna talk about the signs and symptoms, the way to diagnose it, and also the treatment of urinary tract infection. So what is urinary tract infection? Well, urinary tract infection is nothing but some bug in your urine. Usually it is caused by E. coli. It is very common in women. As much as 4 times more common in women than in men. It is common in women because the urethra is very close to the anus. So it's very easy for women to have urinary tract infection. What are some of the signs and symptoms of urinary tract infection? Well, some of the signs and symptoms include frequent urination, burning with urination, which we call dysuria. You may have abnormal smell into your urine. You may also have some back pain, especially if that infection, because remember, urinary tract infection, sometimes it is just an infection of your bladder, but sometimes if it lasts longer, it may go up to your kidney. So it may be an infection to your bladder or infection to your kidney. So you're gonna have those symptoms of frequent urination, burning when you urinate, lower abdominal pain or back pain. Those are the most common signs of urinary tract infection. For short, we call it UTI. Now in seniors, you may have other signs and symptoms, such as in seniors, you may see a lot of the time, you see a lot of confusion, okay? You see a lot of confusion. They may have irritability. They may have issue with their memory. So a lot of different things you see, but mainly confusion is a hallmark sign when it comes to UTI and the seniors. So watch for any type of confusion. So usually UTI is diagnosed by going to your doctor's office. So when you come to our office, we take some urine and we examine the urine to see if those bacteria that cause UTI are present in your urine. And usually, as I said, the bacteria that usually cause UTI is E. coli. So when we check it, it will show that you have bacteria in your urine, and then we'll proceed with treating you. Well, usually because it is a bug, so we treat it with antibiotics. Few things about antibiotics: when you are treated, you may be feeling better after taking the antibiotics for a very short time. But I do want you to continue to take that antibiotics until it is all completed. This is very important. And on one of the future video, we'll be talking about why it is important for any condition. Why is it always important for you to complete the full course of your antibiotics? We'll kind of focus on antibiotics on one of the different videos. But when you have UTI, if you treat it, even though that burning with urination seeing blood in your urine, or lower abdominal pain, frequent urination, even though it gets better, I want you to continue to take that antibiotics. I want you to continue to take the full course of antibiotics. If you treat it for 7 days or 10 days, I want you to continue to take the full treatment of antibiotics to make sure you're fully treated. Now, a few things that people can do to help prevent UTI. You could, when you go to the bathroom, wipe from, don't do back to front, but do front to back, which most people know that. Urinate as frequently as possible, like every 2 to 3 hours. When you go to the bathroom, sit down, take your time, empty your bladder completely. That will help you. Keep yourself hydrated. Drink a lot of water. That will help you so you can flush any type of bacteria. After sexual relation, whenever you have sex, after sex, you want to go and you want to pee and flush things out. You don't want to leave it in there, because leaving it in there put you at high risk of having some bacteria get in your bladder and make you sick. Now, usually the difference between sometimes you have UTI, you see some people with UTI, they may have fevers. But the people with fevers is the late stage of the UTI. So when you have a urinary tract infection, initially the infection is in your bladder. So from your bladder, if it's not treated, it may go up to your kidney. That's when people start having symptoms like fevers, chills. So this is really, it's getting very bad. And this is when people are in a situation where they cannot be treated with oral antibiotics. Some of them, they have to be put on IV antibiotics, which means being hospitalized, being in the hospital for a few days. But really, again, we were talking about the things that you do to prevent urinary tract infection. Again, keep yourself hydrated, drink as much water as you can. When you go to the bathroom, wipe front to back. Make sure you use panties that are cotton, so you can keep everything dry down there. You want to make sure when you have, after any sexual relation, you want to go ahead and flush it out, go pee. Don't just, go to bed. It's better to go and pee and kind of flush the bacteria out. You want to, some people, they drink cranberry juice, even though there is not a scientific proof of cranberry juice helping with UTI, but it does have, there's some evidence that cranberry juice may help you. As far as our seniors, which is the people we usually focus on our videos, so if you have a senior, one of the things I want you to know is pay good attention, because sometimes UTI can be mistaken with dementia. So if somebody has dementia, they may have a UTI, you may think it is the dementia, because again, they will have a lot of confusion. Those people, they will be confused, they may be hallucinating, so they may have all those symptoms and you're thinking what's going on, but it is nothing but UTI, because a lot of the time those seniors, older people, they don't have all the sensory down there, and they may not feel the symptoms that a younger person would have felt, like having the burning, having the frequency and all that. So they may have different symptoms, and usually their symptoms are more confusion, hallucination, and things like that. Usually that's what those older people are having, whereas in younger people you have more like the burning and all that sensation. So with older people, you want to make sure you encourage them to drink water, about 5 glasses of water. You want that every day. You want them to drink several glasses of water. You want to encourage them every 2 to 3 hours. You want to encourage them to empty their bladder. You want to, again, encourage them to empty it completely. Help them to take their time. I know sometimes you may have to take somebody to the bathroom if they can't do it on their own. But when you go there, please take your time. Let them empty their bladder completely, because that's very important. That kind of helps them to flush out everything, and also emptying your bladder, that put you at low risk of having a UTI. So if you again, whether you are older or younger, you want to complete the full course of antibiotics. So when that antibiotic is prescribed, you want to make sure you take all of it. Not just some of it, but you want to take the whole course of antibiotics to make sure that you get rid of the bacteria. And again, as I said, we'll be talking about antibiotics on one of our different videos. But again, what I want you to know is, as far as seniors, you want to make sure that you pay attention when those people start getting confused. You want to pay attention to their confusion and don't look at it, oh, it may be the dementia, but sometimes they just have a urinary tract infection. A urinary tract infection can cause a lot of problems if you don't get it treated, because if it gets to your kidney, then it can create a lot of problems. Now, you have a lot of people with menopausal women are at high risk for urinary tract infection as well. And again, most of our seniors, they are in their menopause. So there's a lot of ability, and one of the things, they have lack of estrogen. Estrogen helps prevent E. coli. But when you don't have as much estrogen, which is what happens in somebody who is menopausal, so it puts you at higher risk for a urinary tract infection. So you want to make sure that when you're taking care of those people, those senior people, especially the one who are wearing a diaper, the one who are relying on people to assist them with cleaning up, so you want to make sure that you keep good hygiene. It's extremely, extremely, extremely important. This is why I know one of the videos we talk about changing people's diapers on a regular basis. So you have a lot of the people, they are incontinent, urine and stool, so with that put them at a very, very high risk to have a UTI. So what you want to do is to make sure you keep those people dry, you keep them clean, you keep them at a very hygienic condition where it doesn't put them at high risk to have a UTI. Again, I just wanted to bring this topic because I know this is very common. Again, we'll continue to bring as many topics as we can. If you are watching this video, I want you to share it with as many people as many of you been doing. I want you to continue to encourage us in what we're doing, continue to support us, continue to follow us on our channel on YouTube, AWC Home Care. Also, you can visit our website, and our number is 678-696-9905. You can also follow us on Twitter, on Instagram. We're on all the social media doing this type of job. Again, if you know of anybody who needs some education, of any senior community who need help, if you know of anybody who may be at risk at home, who needs somebody to take care of them, you can always reach out to us. Again, the number is 678-696-9905. Please continue to support us, continue to help us in what we're doing, which is providing education for our community that we love very much, providing education for our seniors especially. So I want you guys to continue to support what we're doing. I want you guys to continue to be part of our community effort. Again, as I always say, if you think of a topic that you think we could be talking about, please send me a message. You can private inbox me on Facebook, or you can call our number. Let me know if there's any topic that you feel that we should be talking about. We'll be more than happy to bring that topic up here. And also, if you want to talk about a topic, we'll be more than happy to have you come on our channel and talk about the topic, educating the people. That's why we're here for. It's not a question of who is talking, but whoever can do it, we want to do it. We want to do it together. Thank you guys. Thank you for watching my video. Again, please like our page on YouTube, AWC Home Care. Thank you again, and you all have a great night. I was very, very appreciative of you all spending the time to watch this video, and please continue to share it. I love you all. You all have a good night.